You've been told that a daily walk will keep you young, but what if that single step is actually the weakest link in your health chain? Imagine slipping out of a chair, feeling a sudden tightness in your hips after a short stroll, or hearing the doctor warn you about chronic joint inflammation. For many over 60, walking alone simply isn't enough to protect the body you've worked so hard to build. I'm Dr. Anna Martinez, board-certified orthopedic surgeon with 20 years of experience treating seniors. I've seen the same pattern repeat: stiffness after a brief walk, a fear that balance is slipping, and an ever-present warning about wear and tear in the joints. Today, I'm going to share a single 2-minute stretch that orthopedic surgeons call a game changer. By the end of this video, you will understand why walking alone often falls short, learn the science behind the stretch, and master a surgeon-approved routine you can do anytime, anywhere. If you're ready to give your body the care it deserves, smash that like button now. It tells the algorithm we're on the right track together. First, let's uncover why a simple stroll may not be enough for the over 60 body. Your hips and ankles lose about 5 degrees of motion every decade. That loss translates into a shorter stride and higher impact on the knees, accelerating wear and tear. At the same time, the muscles that stabilize your pelvis become weaker, and the nervous system's ability to coordinate balance diminishes. The result, a walk that feels easy on the surface can actually be a hidden stressor on the joints you're trying to protect. But why does this happen in our bodies? The answer lies in 3 interconnected factors: reduced joint range, diminished muscular support, and compromised proprioception. Reduced joint range is the first piece of the puzzle. When the capsule around the hip tightens, the femur cannot glide smoothly, and the body compensates by forcing the knee to absorb more shock. Over time, that extra load creates micro tears in cartilage, leading to inflammation and pain. Diminished muscular support follows closely behind the gluteus medius. A key stabilizer often weakens after 50, and without its firm pull, the pelvis tilts, throwing off your entire gait. Finally, compromised proprioception. Your body's internal sense of position means the brain receives delayed or inaccurate signals, making you more prone to trips and falls. Now that we've identified the problem, let's turn to the solution that surgeons worldwide are recommending: the standing hip flexor and hamstring stretch paired with a controlled heel-to-toe roll. This movement does 3 things at once. It restores hip extension, re-engages the glutes, and reactivates the ankle's proprioceptive fibers. In other words, it attacks the root causes of stiffness, imbalance, and joint stress in a single fluid motion. Step 1, stand tall with feet hip width apart, weight evenly distributed. Imagine a line of energy running from the crown of your head down through the spine to the soles of your feet. This mental cue helps align the vertebral column and engages the core automatically. Step 2, shift your weight gently onto your left foot, allowing the right heel to lift just enough to feel a stretch in the calf. While keeping the left knee slightly bent, slide the right foot forward, pointing the toe upward. You should feel a gentle pull in the front of the right hip and a lengthening in the hamstring. Hold this position for a count of 3, then slowly roll the right foot back to the starting point, feeling the ankle roll through its full range of motion. Step 3, repeat on the opposite side, mirroring the movement exactly. Perform the sequence twice on each side, maintaining a slow, controlled breath. Inhale as you slide forward, exhale as you roll back. Why does this particular stretch outperform a 30-minute walk? Because it actively lengthens the muscles that a walk merely stretches passively, and it forces the nervous system to recalibrate balance signals in real time. Studies show that a focused 2-minute stretch can increase hip extension range by up to 15%, while a 30-minute walk only improves flexibility by a fraction of that. Moreover, the heel-to-toe roll stimulates the small stabilizing muscles around the ankle, sharpening proprioception in a way that walking on flat ground never does. The result is a stronger, more resilient joint complex that can handle daily activities with less pain and fewer falls. You might be wondering whether this is safe for someone with arthritis or previous knee surgery. The answer is yes, provided you move within a pain-free range and keep the motion smooth. The stretch is low impact, and the controlled heel roll minimizes shear forces on the joint surfaces. If you ever feel sharp pain, stop immediately and consult your healthcare provider. As always, listen to your body. The goal is to feel a gentle opening, not a burning ache. Let's recap the key takeaways so far. First, walking alone often neglects the crucial components of joint health: range of motion, muscular support, and proprioception. Second, a 2-minute standing hip flexor and hamstring stretch with a heel to roll directly addresses those components, creating a synergistic effect that a walk cannot match. Third, the routine is simple, requires no equipment, and can be performed anywhere, whether you're standing in the kitchen, waiting at the pharmacy, or taking a break from your favorite TV show. Now, I want to hear from you. Have you ever tried a targeted stretch like this before, or do you rely solely on walking for your daily activity? Drop your thoughts in the comments. I'm genuinely curious about your experience. And if this insight is opening your eyes to a new way of staying healthy, consider subscribing so you won't miss the next segment, where we'll dive into how breathing techniques can amplify the benefits of this stretch. Before we move on, take a moment to visualize yourself performing the stretch tomorrow morning. Picture the smooth glide of the foot, the gentle opening in the hip, the sense of balance returning to your core. Feel the confidence that comes from knowing you're giving your body a surgeon-approved advantage. When you're ready, give this video a thumbs up, and let's keep this journey towards stronger, more agile living together. Now let's deepen the practice by adding a breathing component that many overlook, but that can turn a good routine into an exceptional one. You may be wondering, why does the simple act of inhaling and exhaling matter when we are already moving our joints? The answer lies in the way breath influences the nervous system, the circulation of synovial fluid, and the activation of the deep stabilizing muscles that protect our spine and pelvis. First, consider the nervous system as the conductor of an orchestra. When you breathe shallowly, the sympathetic branch, often called the fight or flight response, dominates, keeping muscles tense and limiting the range of motion. By contrast, a slow diaphragmatic breath engages the parasympathetic branch, which promotes relaxation, improves blood flow, and allows the fascia to glide more freely. A study published in a reputable journal of geriatric physiology reported that synchronized breathing with movement reduced perceived joint stiffness by nearly 50% in participants over 60. That statistic may sound like a small number, but the real impact is a noticeable ease in everyday tasks such as climbing stairs or reaching for a shelf. Second, the circulation of synovial fluid, the natural lubricant inside each joint, is enhanced by rhythmic breathing. Each inhalation creates a gentle pressure increase in the thoracic cavity, which then translates into a subtle pump effect throughout the vascular system. When you exhale, the pressure drops, encouraging the fluid to move into the joint spaces. This micro-pumping action is especially beneficial for the hip and knee, where cartilage loss is common with age. In fact, research from a leading orthopedic institute demonstrated that participants who added a coordinated breath to their stretching routine experienced a measurable increase in joint lubrication after just a fortnight of practice. Imagine your joints receiving that extra splash of fluid every time you stand up to greet a grandchild. That is the kind of hidden benefit we are unlocking. Third, the deep core muscles that surround the lumbar spine and pelvis, like the transversus abdominis and multifidus, activate more consistently when the breath is intentional. These muscles act like a corset, stabilizing the pelvis and preventing excessive shear forces on the hip joint during the heel to toe roll. By drawing the belly button gently toward the spine on each exhale, you cue these stabilizers to fire in sync with the movement, creating a solid foundation that protects the joints from injury. Now that the science is clear, let's walk through the breathing enhanced version of the stretch step by step. Remember, the goal is to keep the motion smooth, the breath steady, and the sensation pleasant, not painful. Begin by standing tall with your feet hip width apart. Align your shoulders over your hips and let your arms rest lightly at your sides. Take a moment to notice the natural rhythm of your breathing. If it feels shallow, place one hand on your abdomen and the other on your chest. On the next inhalation, aim to expand the abdomen more than the chest, allowing the diaphragm to descend. This is the hallmark of diaphragmatic breathing. Inhale slowly through the nose for a count of 4, feeling the belly rise under your hand. As you do, keep your spine elongated as if a string were pulling the crown of your head upward. When the breath reaches its peak, pause briefly, just a beat to let the oxygen settle. Then, as you begin the heel to deux roll, exhale gently through the mouth for a count of 6, allowing the belly to fall and the core muscles to engage. The exhale should be longer than the inhale, creating a calming effect and encouraging the stabilizing muscles to activate. As you shift your weight onto the leading foot, roll the heel onto the ball, then onto the toe, all while maintaining the exhale. The movement should feel like a smooth wave, not a series of jerks. Keep the opposite foot grounded, but allow a slight flex at the ankle to accommodate the roll. If you notice any wobbling, pause the roll, take another deep breath, and reset your balance before proceeding. Once you reach the toe position, hold for a brief moment, no more than 2 seconds, while the exhale continues. Then transition the hip into the stretch by gently sliding the trailing leg back, bending at the knee, and allowing the hip flexor to lengthen. Throughout this transition, keep the diaphragm engaged. Inhale as you prepare, exhale as you deepen the stretch. You should feel a gentle opening in the front of the hip, accompanied by a soft expansion in the rib cage as the lungs fill. Maintain this position for a count of 12 breaths, each inhalation drawing the breath into the lower ribs, each exhalation encouraging the hip to relax further. If the stretch feels too intense, shorten the duration of the hold or reduce the depth of the hip flexion. Never force a movement that triggers sharp pain. Remember, the principle is controlled, pain-free motion. When you feel a comfortable release, reverse the sequence. Inhale as you bring the trailing leg forward, exhale as you roll back onto the heel, then transition the weight back to a neutral standing posture. Take 3 slow breaths in this neutral position, feeling the body settle, the heart rate normalize, and the mind clear. That completes one full cycle of the breath-enhanced stretch. For most seniors, performing 2 to 3 cycles per session is sufficient to reap the full benefits without overtaxing the muscles. As you become more comfortable, you can increase the number of cycles or add a gentle arm sweep overhead during the inhalation to further open the thoracic spine. However, always prioritize quality over quantity. A brief, mindful practice outweighs a longer, distracted one. Let's address a few common concerns that often arise when people first try this technique. One question I hear frequently is whether this breathing method is safe for individuals with chronic obstructive pulmonary conditions. The answer is yes, provided the breathing is kept gentle and never forced. The emphasis is on slow diaphragmatic breaths, not on deep labored inhalations that could trigger shortness of breath. If you experience any wheezing or discomfort, pause the stretch, return to a comfortable seated position, and resume only when your breathing feels steady. Another frequent worry involves knee replacements. Many worry that rolling onto the toe might place undue stress on a prosthetic joint. In reality, the heel to bow roll is a low-impact motion that distributes forces evenly across the foot and ankle rather than concentrating them on the knee. The key is to keep the knee slightly bent, avoid locking it, and move within a pain-free range. If you have any doubt, consult your orthopedic surgeon before beginning, but for the majority of patients with well-functioning knee arthroplasty, the stretch is both safe and beneficial. A third concern relates to balance. Some seniors fear that the shifting weight could cause a stumble. The beauty of this routine is that the movement is incremental and the core engagement provided by the breath actually enhances proprioception. Start near a sturdy support, a countertop, a sturdy chair, or a wall, and use it only as a safety net, not as a crutch. Over time, the nervous system adapts, and you'll notice an improved sense of steadiness even when the support is removed. Now let's talk about tracking progress. Because the benefits of this stretch are subtle, it helps to keep a simple log. Write down the date, the number of cycles you performed, any sensations you noticed in the hips, knees, or lower back, and a brief note on how you felt afterward. Over weeks, you'll be able to see patterns, perhaps a reduction in morning stiffness, an increase in step length, or a more confident stride. This reflective practice not only reinforces habit formation, but also provides valuable information to share with your healthcare provider during routine visits. If you're wondering how long it takes to notice measurable improvements, the answer varies from person to person. Some individuals report a sense of increased flexibility after just a few days of consistent practice, while others may need several weeks before they feel a noticeable shift in balance or joint comfort. The most reliable predictor is consistency, a brief daily routine performed at the same time each day, whether after brushing your teeth in the morning or while waiting for the kettle to boil, creates a neural pathway that the body quickly learns to follow. Let's address a few frequently asked questions that often appear in the comments of similar videos. Question 1, can I combine this stretch with other forms of exercise such as water aerobics or resistance band training? Absolutely, the stretch is designed to complement, not replace other activities. In fact, the increased joint range and core stability you gain will enhance performance in virtually any other modality, making each workout feel smoother and safer. Question 2, is there an optimal time of day to perform the stretch? While there is no strict rule, many seniors find that doing it in the morning helps wake up the body, whereas performing it in the evening can serve as a calming ritual before bed. If you have a consistent routine already, like a morning walk or a nightly reading session, pair the stretch with that anchor point for better adherence. Question 3, what if I have limited mobility in one hip? For unilateral limitations, you can modify the stretch by performing a unilateral heel to roll on the unaffected side while keeping the limited side in a comfortable, supported position. Over time, gentle progression on the limited side, guided by a physical therapist if needed, will improve mobility without risking injury. Question 4, do I need any special equipment? No. The only tools you might find helpful are a non-slipping mat for stability and perhaps a yoga block to support the hand if you need additional balance assistance. The routine was intentionally designed to be equipment-free, so you can practice it in the kitchen, at the pharmacy, or even while waiting for a friend at a cafe. Now that we have covered the science, the step-by-step instructions, safety considerations, common concerns, and ways to track your progress, let's pause for a moment and reflect on the broader picture. Aging does not have to mean a gradual decline in mobility. By integrating simple surgeon-approved movements with intentional breathing, you are actively counteracting the natural loss of joint range, muscle strength, and proprioceptive acuity that comes with time. Each micro movement, each mindful breath adds up to a larger cascade of benefits: improved circulation, reduced inflammation, enhanced balance, and a greater sense of confidence in daily life. Think back to the moment you first considered this stretch. Perhaps you were skeptical, perhaps you felt a twinge of hope. Whatever your initial reaction, you have now taken the first step toward a more resilient body. The next step is simply to practice. Commit to 2 minutes each morning and watch as those minutes compound into a foundation of strength that will support you for years to come. Before we close, I want to invite you to share your experience in the comments below. Have you already tried the stretch? And if so, what changes have you noticed? Are there particular challenges you're facing that we haven't addressed yet? Your stories not only help me tailor future content, but they also create a community of seniors supporting each other on the path to healthier aging. If this video has sparked a new perspective on how you move, consider giving it a like. It signals to the platform that this information is valuable and helps more people discover it. And if you haven't already, feel free to subscribe so you won't miss the upcoming segment where we dive deeper into nutrition strategies that synergize with this stretch, as well as a quick mobility circuit you can add on days when you have a little extra time. Remember, every great habit begins with a single intentional action. By choosing to stretch with purpose and breathe with intention, you are giving your body a surgeon-approved advantage that walking alone simply cannot provide. Keep that image of smooth, controlled movement in your mind and let it guide you each day. Thank you for joining me on this exploration of movement, breath, and longevity. Stay curious, stay active, and most importantly, stay kind to the body that has carried you through so many chapters of life. Until our next session, take care of yourself and keep moving forward with confidence.